Hi, everyone. Welcome to the Good Health Cafe, the place to learn about how to navigate the healthcare system and understand health in plain language. I'm your host, Nikita Boston Fisher, a health educator with a passion for meeting people where they are. Today's guest is Nadia Mbonde. Nadia is a multi-passionate anthropologist. She came to the cafe to discuss her PhD research and also to share her own birth story. Grab your warm drink and tune in for a great conversation. To get started, let's hear how Nadia introduces herself.
Hi, everyone. My name is Nadia Naomi Mbonde. I live in Brooklyn, New York with my 4-year-old daughter. I wear many hats. My most recent training is as an anthropologist. I'm getting my PhD at the Department for Anthropology at NYU. And my research focus is on what I call Black reproductive mental health. I trained as a birth and postpartum doula, full spectrum, which also includes abortion support, mental health support, support for queer, trans, and non-binary families. I'm also an artist. I make films connected to my lived experience and my research. I do photography, digital collage, I dance, I write poetry, kind of all over the map.
With so many talents and interests, you may be wondering what sparked Nadia's interest in being a doula and anthropology. I had the same question. Let's hear how she responds.
So for undergrad, I went to Barnard College of Columbia University, and that's where Black feminist anthropologist Zora Neale Hurston did her training, one of the first Black women anthropologists. And she also wore many hats. She did photography, film, dance, theater. She studied Black people in the South. She studied her own people. So going to school with the legacy of Zora Neale Hurston there was an inspiration to me. I'm American by birth, but I didn't come here till I was 18. I lived in Switzerland prior to the US. So when I came here, I was kind of an insider-outsider because I sound American. I look like I should belong and understand things, but when I came here, I was starting from scratch. So the tools of anthropology and studying my own people, as Zora Neale Hurston did, and just coming with kind of a fresh perspective, eager to learning about systemic racism and Black culture and all of those things from not really having a foundation of knowledge. Anthropology really helped me first to just be comfortable living here and navigating living in New York as a Black woman, which is something, having lived in Europe, it's not an identity that I held prior. I was a US-born Tanzanian, Indian, Guyanese person. And when I came to the US, like a lot of scholars and writers talk about, like Chimamanda Adichie say that, they became Black when they came to the US. And so I really had to understand what that meant for me if I was going to live and thrive here. So that explains some of the formative influences of how I came into anthropology. And then when it comes to my work as a doula, when I graduated from Barnard, I got a little grant to do a project that I started called Embodying Ancestry, because there was a lot of, the 21, 22andMe, Ancestry.com, a lot of digital DNA-based tools that companies were selling to people of African descent to find their roots, right? And I said, well, I think all of that knowledge is within us. We don't need to pay for an outside group to tell us who we are. And so I used the tools of anthropology. I invited about 30 women of color to my home where I, did portraiture of them. I filmed them. I asked them to bring artifacts from their grandparents and their parents, and they would talk about what they were wearing or what they brought. They would start dancing. They would start talking about their relationships to their mothers. And a lot of times, a lot of this ancestry talk had to do with the mother-daughter relationship and what it was like for their mother to be pregnant with them and some of the trauma associated with giving birth. And so that's when I really became interested in how anthropology and reproduction would kind of drive me forth in my interests in my career. So from then on, I studied fitness. I was interested in like prenatal, postnatal yoga, fitness, personal training. I got into a doula training where I learned about the Black maternal mortality crisis. And this was in 2018 when Beyonce and Serena Williams were talking about almost dying during childbirth. So that's where my story with all that began.
I figured with this background and experience, it would give Nadia a leg up on her pregnancy. Let's see if she thought so.
Yes and no.
Oh.
I trained as a doula in 2018. I got pregnant in 2019. And I like to say I was my first client because I did my doula training and then I got pregnant. And I thought I would have all the tools, how to find a midwife, herbs, how to advocate for myself. I first tried for a home birth with a midwife, with a Black midwife. And then that did not work out. I'll explain why in a minute. And then I tried a birthing center, the only one in New York City. That didn't work out. For a similar reason. Basically, I was going into pregnancy with a mental health condition. When I was 18, I was diagnosed with bipolar. And the first thing that came to mind when I got that diagnosis as an 18-year-old was I'm going to be a terrible mother. No one told me that, but there was enough stigma in society, or enough depictions on TV and all these things about crazy mothers, mad mothers, Black angry mad mothers, mentally ill, whatever. That was already baked into me. And I had no coaching. I had no, part of my interest in reproductive mental health and those two things being one is that my gynecologist should really have been talking to me about my medication and planning for pregnancy. And what if I have a unplanned pregnancy? And what do I do about my medication? Do I know my options? Do I know what I need to do if I want to breastfeed? Those kinds of things. And my psychiatrist should have been having those conversations with me about reproduction as well. Like, do you want to be a mother? Are you on birth control? What do you want to do if you become pregnant? Let's get you on a medication from now that won't have negative effects on the fetus if you do become pregnant. None of those conversations happened, right? So when I got pregnant, and I already had the stigma of if I take medication, I'm a bad mom and I'm harming my child, which is not true. There's so many safe psychiatric medications, but that's what I thought. So I went off a medication. Not good to start out, right? I thought I was going to sacrifice myself for my child, in doing that, but I ended up really harming myself. And the thing is that the midwife didn't believe in my diagnosis. She was just like, that's just a label. They just like to call Black people that. And there's a history of overdiagnosis of schizophrenia and bipolar and things that has a racist background. So that's one, and that's a valid, although misguided, it's a valid kind of idea. At the birthing center, they were not taking any clients who needed to be on medication. Oh. So that was not an option for me. And so I was left with a hospital birth, which is the last thing I wanted, given my doula training and given the high rates of mortality that happen in hospitals and the needing to advocate for yourself to reduce interventions. Even at the hospital, the doctors did not know about my medication and what to do. So I was really on my own. And I went through the first and second trimester. I navigated mania, psychosis. I couldn't sleep. I had chronic insomnia because I need medication to sleep, and I thought I couldn't take my medication. So I went to the ER about 3 times, and then I didn't tell them anything that would have them admit me, because then I would lose my autonomy. I wouldn't be able to check myself out. I did actually call 911 at one point, and they took me to the psych ward, and I got out in 3 days because my family intervened for me. But that was not a good situation. It was more like an incarceration in a very low-funded psychiatric unit, which have majority Black and brown people. And I had all kinds of experiences there, which were not necessarily positive. For one, they didn't believe that I was a PhD student who's got into NYU and wanted NSF. They thought that was a delusion when that was the reality. things like that. Because I was 25.
Yeah.
They thought, oh, she's crazy. That's not real. No, very real. And then I like to talk about the connection between the mind and the body, because a lot of these deaths that we're seeing as a result of hemorrhage or heart failure, stroke, there's a mind-body connection. There's stress that can trigger things and vice versa. So my example was, I have some eye problems. I was born with a cataract and I had it removed as a child, but that created this more fragility in my right eye. And I think basically my retina detached in my second trimester. And I remember it detaching at the moment where the mania and the rage was like so high. It was like a very hot summer day and I lost vision. There's like a black curtain that covered over my eye. And I had to get emergency eye surgery and be under the knife. So I was anesthetized, I was pregnant, and I woke up and I was still manic. Thankfully, sleep is the best medicine for a lot of this. So my recovery from eye surgery got me back to my baseline state. And then it's in being in my baseline state that I scrambled to find a psychiatrist. I scrambled to find, to put in place the things that I needed to be well. And I shouldn't have had to do that all by myself. Right. And thankfully, I got back on my meds. My psychiatrist wasn't even a reproductive psychiatrist, but she's so amazing. She took me under her wing. She did the research. She got me on the meds. We monitored my levels. I was able to breastfeed for 2.5 years on my medication. That was amazing. A lot of people are robbed of that experience due to misinformation. And I had a stable, healthy birth and postpartum. And given my diagnosis, I am at a high risk for postpartum psychosis and suicidality, which is a really, really where the deaths are, the mental health related complications happen in the postpartum because of depression and all these other things that go unchecked. But because I was being monitored and I was on my meds, I was fine. So that's why I say, was I prepared? Yes and no. Yes, I knew about, medical racism. I knew how to advocate for myself. I made sure I had a doula. I made sure I had postpartum doulas. I knew how to care for the baby, the newborn, but there was absolutely no education at all about mental health. And so that's why my focus was on Black reproductive mental health.
Wow, what a story. And did you notice that Nadia said once she got back to her baseline, she scrambled to find a psychiatrist? Why do you think she didn't use the psychiatrist she was using in the past? Well, I was curious too. Let's hear what she had to say.
Yeah, basically, I lost my trust in that person. Because, again, I had been with this person for how many years and we had not one conversation about, do you want to be a mother? Do you want to be pregnant? You don't want to be pregnant? What happens if you become pregnant? What's the game plan? What's the crisis plan here? And so I just I felt like that relationship, the rapport was kind of destroyed. And then, while I was already in an altered state, she was like, oh, it's safe. Like she was trying to have the conversation with me when it was a bit too late. With people who experience altered states or psychosis, mania, the best care happens before the episode. You talk, you plan. They're called psychiatric advance directives, which is a document you can try to enforce if you get put in the psych ward and you can't advocate for yourself. But those of us who experience major depression, we can't make the best decisions for ourselves when we're in that state, right? We need to be healthy to have the conversations. What do we do if you're in this state? What makes you feel better? Where can we take you if it's getting to a kind of a dangerous place? Who can we call? What are your wishes, right? Those conversations and that trust needs to be built before. So when you're in that state, I perceived my psychiatrist as hostile. I thought she was lying. I didn't trust her because we didn't have that. We didn't create that safe space before.
How did she go about finding the psychiatrist that she was eventually happy with?
Tough, because I did find reproductive psychiatrists, but, in the U.S., everything is determined by insurance. So before I found that psychiatrist that I still have now, I had to pay $500 for a consult. with a reproductive psychiatrist just to confirm the medication that I was taking would be safe. Just 30 minutes to have that conversation, $500. And my insurance was, not going to pay for all of that, right? So I actually found a psychiatrist in a public clinic. They take Medicaid, they take people who are uninsured. They won't send your bill to collections if you can't pay. And I was just very fortunate that the person who is now my psychiatrist is just that kind of person who decided to rise to the occasion and now has taken on several other clients who are pregnant and postpartum. And I love that. But I believe I was her first. And just the mission of that clinic and how open they are and how open she is, I think is what made me feel safe. And the fact that it was affordable is also the biggest thing.
I always get excited when people find the right provider for them, the one who listens and tries to meet their needs. But it also frustrates me that sometimes people have to go through so much in order to find that person. I asked Nadia what she thought was the toughest part of her experience and what helped her through it.
The thing is, when you're in an altered state, like you're very sensitive, receptive to a lot of things. There's a lot of things that spiritually you may be feeling happening. And it's very hard to do all of that, like to be in that kind of very open space while trying to be in the 3D world and take care of yourself. So I think the hardest things for me were not being believed, like actually prior to getting pregnant. My first pregnancy ended in a miscarriage. I wasn't very far along. It was 8 weeks, but I was a doula, I was trained, I knew I was pregnant. And then the loss actually triggered the psychosis. And I had a very horrible experience going to the doctor and the radiologist because I experienced a lot of pain when they were doing the exam. And they just didn't believe me. They just didn't believe that I was in that much pain. And again, it's a mind-body thing. So even if it's psychosomatic, which we can debate about how much of things are real or not real, but if it's being experienced, it's real. So that was extremely hard. It was extremely hard to navigate being in an altered state with people I thought knew me. And because I'm very open about my diagnosis. So I'd been friends with people for years. And then when they actually saw me like in a crisis mode, they just did not know how to support me or did not understand that certain things were out of my control in terms of what I said or how I behaved. And so there was a lot of rupture in relationships, which was really, really hard. And then, there's just it's impossible in the U.S. to navigate this kind of care. There's only 3 psychiatric units that are for pregnant and postpartum people in the country.
Oh, wow.
Where you can they have all the services. When you give birth, you can have your baby with you. A lot of the times in psych wards, mom and baby are separated. She can't breastfeed. It's really traumatic. So the fact that I couldn't go to the ER when I was suicidal, and I couldn't tell them that because they would just take over my body kind of thing. Or all the different messages. You know how many people told me that I will kill my child if I breastfeed, including professionals? And there's so much misinformation about that. There's still this stigma around, if you take medications, you're going to poison your child kind of thing. So it was scary to have all these experts not know what they're talking about and have to listen to my intuition or be the one to fact check and get the second, third opinions while also still not at my baseline.
A common take-home message in many Good Health Cafe conversations is advocating for yourself. But advocating for yourself does not come naturally to a lot of people, especially when dealing with experts. I was curious, what gave Nadia this confidence? To push, to double check, to triple check? Was it something she was born with?
Well, I study, right? So I trained as a doula. So there's certain things that I know. I'm the type of person that I will go the academic route and learn all things that are in the textbooks. But I also go on the side and be what are they talking about here? The ancestral wisdom, what are they talking about here? I'll kind of get a 360 view of things. And logic, again, this is Europe now because there's different regulations. In Europe, a glass of wine when you're pregnant, no one's going to put you in jail, right? If that is happening with alcohol, And other, even, they've legalized marijuana in the U.S. I don't know if it's everywhere in the U.S., but they're certainly in certain states. And people are prescribed for nausea when they're pregnant. If those things are, considered not toxic at high levels, why is it that the medication that keeps me well is toxic to my child? And is it more toxic that I'm manic and suicidal and psychotic and I'm stressed, I'm not sleeping for weeks on end? What is more toxic? Mm-hmm. Me being stressed out and having all that cortisol, in the system of the baby, or me taking what I need every day to be well?
It sounds like Nadia's confidence in advocating for herself comes from a mix of things, not limited to her exposure, her education, her location, and her personality. Now let's learn a bit about what Nadia's research is about and what she's learning.
Yeah, so I'm writing my dissertation, and I hate this question because as I write, it evolves. But basically, my sense is that if we looked at mental health and reproduction together and not these separate things, we might actually have some answers about how to reduce maternal mortality. Because a lot of early research from Black feminist anthropologists like Leith Mullings, who did a study of Black women in Harlem and their, reproduction, a lot of the conversations around stress and toxic stress and living in a racist country where, Black women from outside of the U.S. who come here, they have good birth outcomes, but their children who grow up here, their outcomes become worse than their mothers, and it just keeps going. So it's an environmental thing. And I am very interested in how Black people, mental health is taboo. It's stigmatized. We're already stigmatized by the fact that we're Black and we're already oppressed. So to add another oppressive identity on top of that is hard. So sometimes we don't talk about a diagnosis, but we'll talk about our back hurting and our stomach aching and we can't sleep or we're stressed. And that is the mental health piece for me. We don't always have to use the language of psychiatry, right? But I can say with a lot of certainty that our experience of toxic stress in this country is what makes us ill physically. So to address that, I think, is the missing piece, because we're always trying to okay, how do we reduce the rates of stroke, infection, this, that? But we're not addressing the source of the issue, which has to do with our mental, physical, spiritual, psychological well-being that then has an impact on our body. So that's why I'm calling it not just Black maternal mental health, but Black reproductive mental health, because it also could begin at birth or in the womb, because like I said, the cortisol, we're already experiencing what our, the birthing person or our mothers are experiencing in the womb, and that already gives us a predisposition to certain kinds of things already. But I'm looking at menstruation to menopause, because how we deal with menstruation or concepts of that either being shameful or how much pain we endure during PMS or whatever. At every stage along our reproductive lifespan, we're dealing with reproductive mental health issues. So there's menstruation, there's preconception, either IVF or attempts at conception. There's pregnancy, birth, premenopause, menopause. I think there's a link between the earlier reproductive experiences that we have and our later outcomes. An example would be if someone has experienced sexual violence earlier on, that impacts the birthing process and how your relationship to that area of your body. And then if you're in the hospital and you have people very insensitively touching you and not asking for consent, that can just bring up a lot of trauma. So yeah, it's a very broad concept, and it's something that I can dedicate my life towards because there's just so much there.
I find Nadia's research so fascinating. I also think it was interesting, the example she shared about sexual violence earlier on and the impact that it could have on the birthing process. Because when I was doing my master's in public health, my thesis was on adverse childhood experiences and the impact on breastfeeding. I asked Nadia if there was anything coming up in her research that she thought was surprising or that would surprise the audience. Let's hear what she had to say.
Yeah, so it's interesting right now. I didn't expect this. I'm trained in a lot of subfields. So there's anthropology, medical anthropology, visual anthropology, MAD studies, which has to do with the way that psychiatric survivors have reclaimed the word MAD. There's, disability studies, people reclaiming disabled. But now my work is going into gender, sexuality, and queer studies because I became very interested in how, now that we're trying to be more inclusive, we use the language of women and birthing people. And birthing people is supposed to be people who don't identify as women, but who can give birth. But I feel like that phrase is just a throwaway. We never actually talk about birthing people in their own right or center them. So I'm like, let's just see what happens if I do that. And I've talked to some non-binary Black people. I've talked to some trans men, also known as seahorse dads, trans men who give birth to their own children. And I'm really interested in how our ideas about gender are part of the problem. So an example of this would be Serena Williams, like world champion in tennis and talked about in the media as super masculine, ugly, man-like. They make fun of her. They call her all kinds of racist, like misogynist things. And if you look at her story of how she almost died in childbirth, it was a classic story of the staff not believing her when she experienced any discomfort or pain, right? Because of racism, the idea of womanhood has kind of been taken away from Black women, and we're seen as more masculine, ability to not experience pain, ability to labor harder than white women, all these kinds of things. Labor in birth as in the time of slavery, but also, work in the fields, work in the home. And so I was like, what if we got rid of that idea that of this gendered idea of, of birth, that birth is this feminine thing, and it's can that free up not only trans people or non-binary people who are discriminated, in hospitals and things, but it will free up the women. Because we don't have to be we don't have to ascribe to beauty standards. We don't have to ascribe to, we have to be in this type of way. We have to be soft-spoken. We have to, it will get rid of that and treat us like humans. So I'm kind of taking a step back here and looking at the history of gender and sexuality from, since slavery. The fact that we were not seen as women allowed for chattel slavery to happen and for our children to be seen as property and for us to be seen as property. So I think maybe people will be surprised by, we think that, gender, sexuality, queerness, that doesn't have to, if you're a cisgendered, heterosexual, whatever person, you don't think that has anything to do with you. But really it does. If you're Black, especially, we're kind of queered. We're kind of in that discourse, even if we don't believe it or don't see it or it's not in our face all the time.
That finding is super interesting, and I'm so glad she gave an example because it really helped to paint the picture of what she was describing. You may recall that earlier in our conversation, Nadia mentioned that she didn't want a hospital birth. I wanted to know how her hospital birth actually turned out.
Honestly, my birth was beautiful. Amazing. And not for what the reason you'd think, because everything that I didn't want to happen happened. Okay? So basically my water broke, but I wasn't having strong contractions. I went to the hospital early because I was anxious. And all doulas will tell you, don't go to the hospital until you're really you're feeling the contractions are really close. I was at home by myself and my water broke. So I went, right? But my contractions weren't strong enough. And this is what happens at the hospital. They don't want to keep you there for several days, right? They want to get you out as fast as possible so they can get the next client in and make more money. So this is where the interventions start, right? If I'm at home, the midwife would just come, make me comfortable. We, do some things to get the contractions going. No, I go to the hospital. What do they want to do? They want to induce me. I didn't want that because once you start one intervention, it's usually a cascade of interventions after yourself. Induction happened. Then I'm on Pitocin, which is a synthetic form of oxytocin. But it comes from pigs and it's really harsh and intense. I was on Pitocin for 8 hours, and it was so painful, but I had support. My doula was there. I didn't want an epidural. I wanted to push my baby out and feel my baby come out. You can still get an epidural and push the baby, but you don't feel anything. And if you get an epidural, you're likely to have a C-section. And I was like, I don't want a C-section, but I need to get this pain. We can't deal with this anymore. So I got an epidural. And wow, that was beautiful. I was like, I had a nice little view of Central Park. You know, people were coming in and out. It was like my doula was like lovely. The doulas really kind of create an atmosphere, right? So she had these little cards of like the really beautiful things, and everyone would come in and comment how beautiful it was, all the nurses and things, and she would just like make it so easy to feel like this is a more homey space. And you know, it was like, I don't know, we're in day 2. A baby isn't descending, right? And her heart rate is going down. You know, my husband's saying to her, heart rate goes up and then it goes back down when he stops. And they're saying, oh, like we need to do an emergency C-section because she's not coming down, her heart rate, blah, blah, blah. And you know, in that moment, I was like, this is not what I wanted. But I remembered embodying ancestry. And I said, you know what? This is exactly what happened to my mother. This is the exact same birth story. I was like, you know what? This is how I was born. This is how my daughter will be born. It is all wow. They take me to the, you know, operating room. You know, I have the baby. She's healthy. And the most remarkable part of this whole story for me is when I was pregnant and navigating altered states, you know, I saw a lot of signs. So everything was a full moon. Everything happened on a full moon. And I became obsessed with the full moon, right? And then I became obsessed with numbers. You know how people like to say, oh, it's 11:11. It's 222. So I kept seeing this one number, right? And I was like, okay, like this is, I'm just going to give a random one. Let's just say it was 11:11. I kept seeing through my pregnancy. I kept seeing the moon, blah, blah, blah. I gave birth to my daughter on a full moon lunar eclipse. At the time was like 11:11 p.m. And so to me, it was like, wow, like I'm stable. I'm on baseline. But there's a God, you know, like there's some greater force that is telling me you're okay. You're not crazy.
Yeah.
Like, you know, and then, yeah, so that's why it was a good birth. Not because like my birth plan, you know, my birth plan was not if it's happened. But because I was so knowledgeable about what was going to happen and what needed to happen, and I was able to surrender, it ended up being a really good birth.
I like how you approached that and how you thought that it's not what I wanted, but it was still beautiful. I thought it helpful to ask for clarification to see how a mental health doula might differ from a traditional doula.
Well, we all have physical health, right? We all have mental health. Well, doulas in general help to navigate through transitions, right? And we have our physical health when we're navigating any transition. We have our mental health. So it's not necessarily that you have to have a diagnosis, but I'm sure you're going to feel some stress. I'm sure you're going to feel some anxiety, fear, worry, doubt, you know. And do you have someone who is taking those things into consideration as you are going through whatever transition it is? So I really wanted that for my pregnancy and postpartum. Someone who's knowledgeable, not only about psychiatric related issues, but just how the mind and the body work together when you're, you know, experiencing these transitions. But because I also have a full spectrum view, mental health doulas are, for me, how I'm defining it, can help you through any transition, making sure that your mental health is also centered in your experience, right? An example of this could be some transitions are really wonderful, right? Like you're getting married. That's amazing, right? But there's so much that can even come with good things, like you're mourning, you're grieving your old life, maybe you're moving to a different country and now you have to adapt. And, you know, it's a beautiful thing that you're starting a new life with someone, but you're also grieving. and adjusting. And your mental health is important to also look at as you're dealing with all of the legal changes, the physical, geographical changes and things. So yeah, I just like to say mental health doula because I don't find that mental health is centered in the services that we offer people.
If you could only take one thing away from my conversation with Nadia, here's what she'd like it to be.
Yeah, we all have mental health. Though I seem to be in a niche, it's really not niche. It's just something that is hard to talk about because this society is so preoccupied with the physical body and with productivity and like what we can tangibly see and measure and all of that. But there's so much else beneath the surface that is not given attention to. And if it's not given attention to, those things will start to manifest, physically, visually, out in the 3D. And we won't be able to address it if we don't deal with the root issue. So, yeah, I have mental health. You have mental health. We all have mental health. We need to start normalizing this. We also need to start centering the most stigmatized conditions because we've kind of destigmatized anxiety and depression, and we can all talk about that. But it's almost made these other conditions that are either related to psychosis or personality related things, or like I'm thinking about OCD, different things like that kind of get left in the margins. And yeah, those experiences, they're valid and they're not scary. They're part of the human experience. And I just want to see more conversations about mental health as a whole and not just the surface level stuff. Like, mental health is life and death. It really is. If we don't take care of it.
Nadia had mentioned that very few hospitals in the country have postpartum psychiatry units. This is not something I'd heard much about before, so I asked her about it, and that led to a very interesting discussion about how quality mental health care is often very segregated in the U.S.
So in New York, we have the Motherhood Center, but it's an outpatient, and it's $800 a day, something like that. It's not like a publicly funded place that anybody can go to, because I did call them, and they required me to go to the ER, get stabilized on medication there, and then work with the reproductive psychiatrists and therapists there. It's really segregated, like the quality mental health care. I've been in both. I've been in one of the best psychiatric hospitals, UCLA Medical Hospital when I was first diagnosed, and I was with celebrities who worked in Hollywood and all this stuff, and we had all these activities, and I had my own room, I had a TV, it was like really high end, but I was like maybe the only Black person there. And then I've been in situations where it's like a prison and it's only people of color, and then the outpatient stuff is like very luxury. So we need more facilities that can address the general public's needs and actually is affordable.
What makes it like a prison?
Yeah, it's very bleak looking. You have a roommate. You don't really have a choice of who you're with. And sometimes I've felt unsafe. And there are security guards. I was in an instance where I saw a patient be tackled and sedated. There is violence that happens that are against the people who are staying there. The food is bad. The activities were like from a child's coloring book, and it's just in this one room that's really bleak looking. Again, the way some of them don't look at you and don't talk to you when you talk to them. When you do have conversations, they don't believe you, right? About, I'm getting my PhD. They're like, sure you are. Yeah, there's just this degradation of your humanity.
Yeah.
So that's why I say it's like a prison because you can't leave. You actually can't leave. And the Black and brown people that I have stayed with have been in there for months because sometimes people's families don't know what to do with them and they're just left there. Sometimes they're taken off the street, like our governor in New York tried to get something passed so that homeless people could just be put into institutions to deal with the unhousing problem. Another thing is the forced treatment. Forced treatment, like you can't say no to the drugs. They can sedate you whenever they want. They can give you whatever they want. And at a place that I stayed for 3 days when I was pregnant, they gave me Haldol, which that person I paid $500 to give me counsel, she said African Americans are more likely to experience lockjaw on Haldol. And guess what happened when I got out the hospital? My jaw locked up and I had to go to the ER. There's so many ways in which the psych ward is a part of the carceral system, is a part of the prison system in America to control people, which is why there is this movement to abolish psychiatry or abolish these institutions. And no cell phones. You can't have certain things that could be weapons. Like if you have a comb, if you have a nail clipper, they take all of that stuff away. You can't have strings around your joggers. Yeah, you can't have your phone. You have to memorize the phone numbers of your loved ones or have them on a piece of paper so you can use the payphone to call them. It's really it's jail.
I was so glad that I asked her this question because I really was not expecting the answer that I received. It really blew me away what the conditions were like. I also followed up to ask about visitors.
Visitors can't see you, but I'm sure every psych ward is different. But sometimes it's like you can only be family. And also, COVID was a whole other thing. Depending on what's going on in the protocols, I saw a loved one in the psych ward during COVID, and they're only allowed like one visitor a day. So you can't even see all your, family. It's like jail. Like I'm saying this. Yeah. Because basically you're not a reliable narrator of your own experience when you're in there. Mm-hmm. So you need advocates on the outside, or you like pretend like you're sane. You get out on good behavior. Again, does it sound like prison? Yes. You don't want to be pregnant in there. You don't want to be postpartum in there. You don't want to have kids in there because it's really inhumane. Mm-hmm. It's inhumane, which is why, again, we have to destigmatize these things. Because it's the stigmatization of mental health issues that create these institutions that treat us like this.
Well, that's it for this episode of The Good Health Cafe. Thank you, everyone, for listening. I am so grateful to Nadia for coming to The Good Health Cafe to share her story with us. She was really transparent and informative. And I hope that you enjoyed this discussion and that you will become more open to discussing mental health in your community and with your family and friends. And that you also felt inspired to advocate for yourself in healthcare settings where necessary. As usual, if you'd like to learn more about The Good Health Cafe, please feel free to check out our website, www.thegoodhealthcafe.com. Follow us on social media and sign up for our mailing list. I will also put Nadia's website in the show notes so that you can learn more about her too, because she is pretty amazing and is doing a lot of really cool things. So until next time, see you in the cafe later. Bye.